name is Scott. I will be talking about abnormal heart sounds and heart murmurs today during a physical assessment. I want to begin by talking about S1 and S2, which are the normal heart sounds, the lub dub of the heart when you listen to it. The extra heart sounds begin with S3, which is the ventral gallop. It can be seen as a physiological, normal expectation in young kids, young adults, healthy adults, and pregnant women. When this becomes abnormal or pathological, it is usually seen in mitral regurgitation or tricuspid regurgitation. The S3 is usually heard after, it is heard after the S2, about a half a second. So if you were listening with the stethoscope, it would sound like lub D dub, where lub D is S1, S2, and then dub is S3. Now, as far as S4, unlike S3, S4 is always pathological. So when you hear S4, the extra heart sound, you know it's caused by a problem with the heart, and that occurs before S1. Usually it sounds in the stethoscope like Lee, lub dub, where Lee is the S4 and then it's S1 and S2. And this is seen in common in aortic stenosis. And as far as heart murmurs go, we'll begin with those. The classifications of heart murmurs are usually either systolic or diastolic. Systolic occur during the contraction of the heart during the S1, S2. These are aortic stenosis, pulmonic stenosis, mitral regurgitation, and tricuspid regurgitation. Now, in the diastolic, those are classified. The murmurs falling in there would be aortic regurgitation, pulmonic regurgitation, mitral stenosis, and tricuspid stenosis. So to begin with this assessment, I'd like to invite my patient in. I'd introduce myself, wash my hands. So as we would get her to slide into the picture. Basically, what I'm gonna do first is lay her down and let her lay on the left side, because the mitral stenosis, mitral regurgitation, and tricuspid heart murmurs are most easily heard on her left lateral recumbent. So I'm gonna get her to lay on her left side. And the thing is with these mitral, tricuspid, and mitral murmurs, they're usually very soft and continuous. So the easiest way to hear those is usually with the bell of the stethoscope, and where you can listen to the fourth intercostal space and the fifth intercostal space. One note is the mitral valve regurgitation actually radiates to the axillary. So what I'm going to do now is just listen to those areas now. And again, what I'm listening for is the tricuspid regurgitation is usually heard again at the fourth intercostal space. It's a soft, continuous murmur. The mitral valve regurgitation is a blowing, continuous murmur, and that's usually heard at the apex of the heart. And then you would have mitral stenosis, which is a low lumbering, best heard at the apex as well. And basically all you're doing is listening for that. The one thing about mitral stenosis is sometimes you can hear the opening snap, which is basically a very loud S1, and that kind of gives the mitral stenosis away. And basically those are the areas you want to listen to for these type of heart murmurs. Now, to hear the other heart murmurs, what I'm going to do is, so now I'm going to have the patient set upright. It's best to have the patient leaning slightly forward for this examination of the other heart murmurs. So the heart murmurs we're going to listen to now is the aortic stenosis, aortic regurgitation, pulmonic stenosis, and pulmonic insufficiency. And each one of these are heard pretty much in kind of the same area. And again, I'm gonna have the patient lean forward, take a deep breath, breathe out. And after she breathes out, to hold her breath as we listen. And we're gonna listen for these heart sounds. Basically, the aortic stenosis is going to be heard best in kind of like the second intercostal space on the left sternal border, and sometimes that radiates to your carotids. It's a very harsh murmur, and it has the crescendo, decrescendo flow to it. It basically gets very high and then it fades off as the murmur goes. Pulmonic, very similar. Pulmonic stenosis is very similar as well. It's very harsh. It's heard on the second and third intercostal space. The aortic regurgitation is a lower pitch, so it's a little bit harder to hear, and that's usually heard around Erb's point, right here on the third intercostal space. So what I'm going to do now is listen to those areas, okay? And we're going to listen to these areas. Go ahead and breathe out, hold. All right, go ahead and breathe out, hold. Go ahead and breathe out, hold. Then we'll switch back to the diaphragm and listen again. Breathe out, hold. Breathe out, hold. Breathe out, hold. All right. And that basically concludes today's presentation on abnormal heart sounds.